Thank you, Mr. Chair. I'll try in the next 10 minutes to be brief and
middle button advances
and talk to you about the role of healthcare professionals for maternal newborn health. And I'm going to talk from the FIGO perspective. All of you know FIGO is the Federation International of Gynecology and Obstetrics. So the FIGO's objective and vision is that women of the world achieve the highest possible standards of physical, mental, reproductive, and sexual health and well-being throughout their life. So it's from pre-birth to adulthood and then to retirement time. Now FIGO has many committees and working groups, as you can see on the board. I can tell you you can read them. The most important ones are really all there to see the ethical aspects. So all countries should agree to follow the ethical guidelines of FIGO, reproductive medicine, gynecological cancer, safe motherhood, extremely important. And if you look at the working groups, one of the main important working group is the prevention of unsafe abortion, an initiative in some 40 countries. Health professional associations, I believe, have a vital role to play in the promotion of women's health, especially maternal newborn health. We have an important work to do to reach the MDG 4 and 5. Some of the things that FIGO has been doing: number one, capacity building of health professional association. Time is gone where our professional organizations are carried in the suitcase of the president, and if he doesn't open his suitcase, then nothing happens. We want professional organizations to have an office, to be reachable, to be in contact with the government, with the other associations on a regular basis. What can a national society do? It can improve the quality of reproductive health, and I'll come back to that. Outcome analysis, what is this? Well, we need to collect and help collect statistics. If the OBGYN or the physician in the hospital is not liking to collect statistics on morbidity and mortality, then the rest of the team will not do it either. Which lead us to the third area, which is audit and confidential inquiry. So we're hoping that within the next 5 years, everywhere where women deliver, there will be confidential inquiry. What that is that you're looking at the results of the treatment that you're providing women in your community. And that has to be done in collaboration with the midwives, the nurses, and even the administrators of the hospital. Finally, ethical standards, as I mentioned, this needs to be reviewed at each country and making sure that each hospital has these ethical standards written. I remember visiting a remote town in Guatemala, and the OBGYN and the midwife were so upset that people were paying under the table, the nurses, the midwives, and the doctors, that they put a big sign at the entrance of the maternity ward: all treatment here are free. So I think that was an example of what you can do. Some other FIGO programs: Saving Mothers and Newborn Initiative. This is a program that just finished in 10 countries. The countries are listed there. On the FIGO website, you'll have the results. I talked about one this morning that was done in Uruguay on unsafe abortion. In Haiti, we converted a outpatient clinic into a maternity hospital, and we were the first ones to work after the terrible earthquake. So there's a lot of examples of what can be done. 6 of the 10 programs were done in close collaboration with nurse midwives. The FIGO is also now into a 5-year project called the Logic Initiative, and this is to exactly increase the capacity of professional organizations to respond to the needs of women in their country, and especially in labor delivery in the area of gynecological cancer. So this is extremely important, and what we found when we do the analysis is that the country associations are not prepared to meet that. They don't have much funding, the organizations are lacking, so it's extremely important to provide that support. So what can professional associations do? Briefly, influence policy. You realize that most countries, the higher level of people, so-called higher level, I could question that, but the people who are ministers of health, who are presidents of the country, these people have families. These people will need care of pregnancy. Where are they going to get it? Usually from an OBGYN in a country. So then we try to teach people to use this to influence then the behavior and the commitment of these senior people in their country. Standard setting. They need to adopt guidelines. One of the worst things why we're behind in postpartum hemorrhage and preeclampsia is that when you walk into an institution, there's 8 doctors and 6 midwives, you may have 7 protocols. We need to work to unify this, have one protocol, and everybody has to agree to follow that protocol. Promotion of assessment and audits, as I mentioned, awareness raising and team building. You need to work on this in the hospital. It doesn't come naturally. People have got to communicate better. Continuing medical education, and finally working in partnerships. So really what we're talking when we're talking about reducing maternal mortality and morbidity, it starts before the pregnancy, during the pregnancy, the birth, and after the pregnancy. So the continuum of care is extremely important. Another example of FIGO activities, the misoprostol for postpartum hemorrhage and low resource settings. FIGO has been working with Genuity, USAID, and others to promote the registration of misoprostol, but also the safe use of misoprostol. Unsafe Abortion Initiative, as I mentioned a while ago, this is a project in 40 countries where we're mapping out the services and helping people organize post-abortal care and then trying to influence the change in policy at the country level. Fistula Initiative, FIGO has now worked with urologists and to come up with a standard textbook on what procedures should be done. Again, there was about 20 different methods of treating fistula patients and the follow-up. So we unified this and we produce now the standards for this. So what is the role of FIGO members, OBGYNs? They have 4 roles: leadership, advocacy, champions, collaborator. Leadership, think outside the box on issues. For example, in Uganda, the Kibali project that FIGO ran, they organized a community funding because they found that their transport was a problem. Nobody had money, they couldn't pay for the petrol, etc. So they organized this by working with 200 community health workers, and there is no delay anymore to reach the hospital. Provide members of parliament information on maternal mortality audits. Again, an example of Uganda, where there is a commission now on parliament that meets a committee every year on maternal mortality audit. It's in every newspaper. I can tell you that 5 years ago it was not in the newspapers. FIGO task shifting. I noticed the posters, and I was very happy to see that most countries, midwives were allowed to use oxytocin and other medication. I think midwives, we need to push the frontier so that they can even use tamponade and other procedures when there's severe PPH. Code of ethics, as I mentioned, I think we, the gynecologists, are in a privileged position, so therefore we should not accept stockouts. I can tell you that some of the people on the panel, including myself, I would be so raging mad if there was one day without oxytocin in my hospital, my manager would never do it again. So how come it happens all the time? So we need to wake up our members and say, that's unacceptable. All of you walk into the manager's office and say you'll throw them out if that happens again. We can't just stand there and say, well, there's stockouts. So that's a leadership role that we have to take. Advocacy, radio and TV programs. This is really important. We need to be out and seen. So therefore, when you have these talk shows, it's one of the best ways to spread the information on what women should receive as treatment. For other example is parliamentary debates, as I mentioned, choice of labor positions, and support of women's group in securing misoprostol. We should not try to work in a silo. We need to work with our other partners, the nurse, the midwives, the community health workers. And I think if we do that with the women's group, we can accomplish quite a bit. Champions, tackle unpopular issues for the government of the day. So really, we have to talk about the human resources. One of the projects that we started in Uganda was not in a project design, but all the midwives had said to us that they were 6 months without being paid. Now, talk about a bad way to start a project. So we immediately paid them up for 6 months and then had to run after the government for their support. But these are things that really can make or break a project. Collaboration, I won't list them all because you have there all of the agencies that we collaborate on an ongoing basis, whether they're UN agencies, whether they're NGOs, etc. ICM collaboration, we have worked very closely in most of all of our projects. We have done, as you know, joint statements. We began in 2003 this campaign to reduce mortality and morbidity for PPH. So what is the take-home messages? In my last minute, I will tell you that it's a repeat of what I said at the beginning. We have to act on quality of birthing unit. You know, you can't receive somebody in your house if it's in disorder. So none of us should be willing to work in a hospital that is not clean, that has not received any paint for 20 years, etc. We need to have and to encourage a policy on privacy and policy on respect of women. Quality of care, as we're talking today, and quality of staff-patient interaction. So we can work right away on the quality of the communication between OBGYNs and midwives, but also on the communication with the patient. Audit and confidential inquiry. We are taking the leadership in many countries, and if you do have some difficulty in your country, please do not hesitate to write to me, and I'll make sure that the FIGO Association is working with you. Leadership role in implementing standards. Again, a single guideline for PPH, a single guideline for preeclampsia and eclampsia. And ethical standards are really important. FIGO has developed ethical standards. If you haven't seen them, go to the FIGO website and you'll see them. So, we are making a difference, I think, in the world. FIGO has turned itself from being, I remember about 10 years ago, where the FIGO congresses, all they were talking about is microsurgery and, you know, color ultrasound, etc. You will see now that the meetings, more than 50% of the meetings are on issues in low-resource countries. Unique role of leadership, cultural safety, advocacy, and champions of the world stage. We are present in the regional forums at the country level, and we hope that everywhere where an OBGYN is working, he is fighting with all of you to provide better care for the women of the world. Thank you.